Yes, sir, I can see it. Yes, sir. Yes, sir. Good evening. Oh, good evening, sir. Okay. Well, yeah. It's a 34-year-old male. He has pain of both lower limbs while walking for a duration of 6 months. Pain in right hand for a duration of 2 months, and black discoloration for a duration of 2 months over his right thumb, right middle finger, and right ring finger. So, young male, and it looks like there is a history of claudication because pain is on pronounced on walking over both lower limbs. It could be claudication, sir. And along with the history of blackish discoloration of the digits, that is again favors a diagnosis an arterial occlusive disease, probably peripheral vascular disease. If the occlusion is in the subclavian, okay, yeah, if the occlusion is in the subclavian artery, um, one possibility is subclavian steal syndrome. So the patient, so when the patient exerts, especially while he moves the affected upper limb, when he exerts with the affected upper limb, the posterior circulation is shunted to the right upper limb. So that can cause giddiness, maybe LOC as well, loss of consciousness as well. Yes, sir. Yes, sir. I can see the slide. Okay. So here are insidious onset, gradual and aggravated by activity. So I'm not able to see the slide anymore. Okay. Yeah. Now I can see it. And yeah, now I can see. Yes. Now I can see the slide, sir. Okay. And 45-day duration of blackish discoloration of right hand, progressing over 2 weeks to involve thumb, index, and middle finger. There is no discharge or false meaning discharge. Yes, sir. Okay. So, claudication, neurogenic versus vascular. So, vascular claudication is um, the typical history is the claudication, the pain sets in while the after the patient has exerted for some time. So after the patient may have walked for say 100 meters or 200 meters, that's when the pain sets in. Whereas the neurogenic sort of claudication, it is manifested when the patient when there is a nerve or the root compression is there. So when the patient on bending or say when the patient it's usually there is no it is not aggravated by exertion as such. It is at the onset itself. Like when the patient walks itself, the patient may get pain. Okay. No. Okay, sir. Okay, sir. Okay, sir. Okay. All right. Sir. Okay. 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 Yes, sir. Yes, sir. Lumbar canal stenosis. Yes, sir. Venous claudication. I think it would be seen in patients with varicose veins or venous perforator insufficiency, sir. So, yes. So I think that it would manifest on prolonged standing, uh, and there will be associated symptoms like itching, like lipodermatosclerosis. So those symptoms may also be present in the patient, sir. On prolonged standing, it is aggravated. There may be edema of the lower limb. So, okay, sir. Okay, sir. Okay, okay, sir. Likely arterial, sir. It's arterial claudication. Okay, sir. Okay, sir. Mm-hmm. Okay. Is it because of the motor effect, sir? Is it because of the motor inception? Okay, sir. Okay. 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 Okay, sir. Vascular is gradual onset, and typically there is claudication distance. So there is a particular distance that the patient can walk until the symptoms are aggravated, and progressively the symptoms can occur more frequently and the at shorter distances. Whereas in neurogenic claudication, it is caused by lumbar spinal stenosis or nerve root compression. There is pain of the whole leg and can be associated with tingling and numbness, usually bilateral. Suddenly, pain on standing up or walking, and relief does not occur promptly once activity has ceased. Complete symptomatic relief may take half an hour to 1 hour or longer by sitting, bending forward, or stoppage of walking. Yes. Okay, sir. Okay. Gluteal region, probably the with the Ehlers syndrome, sir. Okay. 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 Uh, so, personal history is a smoker for 8 years, a total of 8 pack years. Yes, sir. Young male smoker. So, yes. On examination, patient is conscious and oriented. Vitals, peripheral pulses, bilateral radial and ulnar pulses are absent. Left brachial pulses present. Bilateral dorsalis pedis, anterior tibial, posterior tibial, and popliteal are absent. BP is 120 by 80. Temperature is normal, and systemic examination are within normal limits. Okay, sir. Um, I think, sir, one thing may be the onset of symptoms, since the onset is only 6 months. Yes. Okay, sir. Okay. Okay. So holding rather than the okay. Okay. Mm. Okay, sir. It uh, looks like there's dry gangrene, sir. Probably due to, again, secondly to the arterial occlusion. That is one, two. Middle, I can see the middle finger and the ring finger. Yeah, mainly the middle finger and ring finger are involved. Okay, sir. Yes, yes. Yes, pain with both lower limbs for 6 months, pain over right hand over 2 months, and blackish discoloration over right hand, involving progressing over 2 weeks, involving the thumb, index, and middle finger. Progressive. Yes, sir. Yes. So dry gangrene is typically seen in the digits or the limbs, whereas wet gangrene involves internal organs. So bowel is usually the most common. And then mechanism, arterial occlusion is the cause for dry gangrene, whereas venous obstruction is the cause for wet gangrene. Macroscopically, the gangrene appears dry and black, whereas in wet gangrene it looks moist, swollen, rotten, and dark. And putrefaction is usually seen in wet gangrene. And dry gangrene, there is usually a clear line of demarcation, whereas in wet gangrene it is absent. And bacteria is typically present in wet gangrene, and prognosis is better for dry gangrene. And wet gangrene, due to bacteria and toxemia, it is bad. So considering the patient is a young male with smoking history, Burgess disease could be one of the most likely differentials. Thromboangiitis obliterans. Yes, sir. Yes, sir. And yes, sir. Um, Maybe some large vessel vasculitis can also cause tachyasu, but that is unlikely in a young male. This patient, sir. It's more commonly seen in females. Uh, okay, sir. Yes, sir. Yes. Okay, sir. Okay. It can be possible, but considering the patient is young and if it's atherosclerotic PVD, usually typically occurs in elderly people, and it will be a chronic occlusive phenomenon will be there, like you mentioned, sir. So this is a more acute presentation, so it is less likely. An atherosclerotic disease is less likely, I think, sir. Okay. Yes, sir. Smoking. Yes. Thoracic outlet syndrome, the typical history was not mentioned, and there is no. Yes, sir. Thoracic outlet syndrome, there can be wasting of the muscles of the involved side, and there can be superior vena cava obstruction, so congestion of the face can be present, and so nerve, artery and vein. So and this subclavian steel phenomenon that typically is not there. So that is also okay. Yes, okay, sir. So CBC. It's showing that hemoglobin of 16, platelets of 3.69 lakhs, lymphocytes. Hemoglobin is 16, platelets is 3.7 lakhs, WBC is 9.9 thousand, differential is 63 neutrophils and lymphocytes 22, ESR is 6, urea and creatinine is 25 urea and zero point 0.8 creatinine. Liver function test is normal, total cholesterol is 170, Triglycerides are 112, LDL is 105, it is slightly elevated. Rheumatoid factor is negative. C3 and C4, C3 is 441. Yeah, it looks normal. Yes, sir. Showing a angiography, sir. Angiography. Okay, sir. It's showing non-opacification in the distal half of radial artery, suggestive of complete block, and non-opacification of distal one third of ulnar arteries, and suggestive of complete block. The right upper limb. Uh, Thromboangiitis obliterans. So, thromboangiitis obliterans is a disease that is seen in typically in young males who are smokers, and it affects all three. So it can involve artery, vein, and nerve, sir. So Raynaud's phenomenon, claudication, and thrombophlebitis. So claudication is 50 young males. Second, atherosclerosis. Okay. Tobacco use. Yes. Extremity ischemia. And some arterial findings of yes. Okay. And autoimmune disease. Okay, okay, sir. Okay, sir. Uh, Mentioned that patient should be a male tobacco users. The onset of disease has to be before 45 years. Distal extremities involved first without embolic or atherosclerotic features. Absence of diabetes mellitus or hyperlipidemia, and thrombophlebitis may or may not occur with or without thrombophlebitis. Yes, sir. So, treatment wise, the most important thing is to ask the patient to stop smoking. So, cessation of smoking is the mainstay. Um, and then, followed by which we can give oral drugs to improve the circulation. The drugs like silastazol can be given, sir. Not sure. And then, angioplasty. Yes. Okay. Pneumatic compression, vasodilators, phosphodiesterase inhibitors like silastazol, intravenous prostaglandins can be given. Okay. Okay, sir. Okay. 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 Okay, sir. Okay. So prostaglandins dilate the systemic and pulmonary arterial vasculature. It suppresses the vascular smooth muscle proliferation, and it inhibits platelet aggregation. It's an endogenous inhibitor of platelet aggregation. This is PGE1. Okay. Okay, sir. Sorry, sir. Could you repeat that? I was not able to hear. Ah, Uh, okay, sir. Yes, sir. Yeah. So, dry gangrene. So, if the finger is gangrene, that particular phalanx or digit has to be amputated, sir. And okay, okay, sir. Okay, sir. Okay, okay, okay. Okay, let it fall off. Okay. Uh-huh. Okay, sir. Okay, okay. Um, in cases where surgery may not be feasible, PG1 can be tried, sir. So, okay, 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 sir. Okay, 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 okay. So, headache and dizziness, and flushing, hypotension, palpitations, arrhythmias, and cardiac arrest, bronchospasm, cough, apnea, nausea, and diarrhea. So GI, yes, yeah, GI side effects, respiratory side effects, and symptoms like hot flashes, so flushing, hypotension, and headache, dizziness can all occur. Cause of death would probably be due to secondary infections, sir. So sepsis, I think, uh, and okay, sir. Okay, sir. Okay, sir. Okay, 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 sir. Yes, sir. I have not seen this. I have not seen such a case till now, sir. No. Hmm. Okay, sir. Okay, sir. Yes, sir. Yes, sir. Yes, sir. Quite interesting, sir. Yes, sir. Please. Sir, and yes, sir. And pre-duty days also usually free, but today, unfortunately,